Hello everyone, welcome back to NK Tips and welcome back to our weekly health tips series. So today we are discussing women fertility and complications that come along with it. But before we get into today's video, if you haven't looked at my previous video, I talked about menstrual cycle in that very video. So if you haven't looked at it, please go back and watch that video because you would need that information to better appreciate what we are talking about here today. So let's get into today's video. Today we are discussing women's fertility, as I said. When we talk about women's fertility, it's simply a woman's ability to carry a pregnancy, to conceive and carry a pregnancy to term. Okay, and this hinges on several factors. First is healthy egg production. Second is healthy fallopian tubes. Next is regular ovulation. Next is a receptive uterus. Next is balanced hormones. Okay, so for a woman to be able to conceive, all of these things should be in order. Okay, so the next point is how the fertility system works. Okay, that is where I want you to have a look at that previous video because I took time to explain the menstrual cycle, and that will better help you appreciate how pregnancy comes about. Okay, so we'll skip this point and then go to the signs that you see that should tell you that probably if you're a woman you might have fertility complications. Okay, first point is irregular periods. If you're a woman and then your menstrual cycle is less than 21 days or more than 35 days, I mentioned this one in the previous video, that means you may have complications when it comes to your fertility. Okay, next point is skipped periods. So if there are some months that you're not seeing your period, it should tell you that you may have complications in trying to give birth. Okay, third is painful periods that we call dysmenorrhea. Fourth is very heavy bleeding. Another point is excessive facial or body hair, which we see in the case of PCOS, which is polycystic ovarian syndrome. And next is painful sex or pain during sex, okay, which may be indicative of a possible PID, which is pelvic inflammatory disease. And then repeated miscarriages. Okay, so if you see any of these signs, it could mean that you may have complications when it comes to your fertility. And what you should note is also that if you have normal or irregular menstrual cycle, that doesn't mean that you are not going to have issues with your fertility. Okay, you may have a normal menstrual cycle and still have issues with your fertility. Okay, so let's move on and look at some major causes of female fertility complications. First point is ovulation disorders. Okay, why does it happen? It may happen because your hormones are imbalanced. Okay, hormones are not balanced. Secondly, the body isn't releasing eggs regularly. Or third point, ovaries are not responding properly to FSH and LH. Okay, and we may see this in conditions such as PCOS, which is polycystic ovarian syndrome, where we have irregular or absent periods, excess male hormones, many immature follicles in the ovaries, and weight gain and acne. Alright, another condition is thyroid disorders. Okay, thyroid disorders. Both hyperthyroidism and hypothyroidism can disrupt a woman's ovulation. Okay, so thyroid disorders is also one condition. And then the next one is high prolactin. You know, prolactin is the hormone that is responsible to help the woman produce milk. All right, when the woman is lactating. So if we have higher prolactin levels, it can disturb the woman's ovulation. Okay, and then the second point we want to talk about is blocked or damaged fallopian tubes as a reason why a woman might have complications when it comes to fertility. So your tubes can be blocked as a result of a pelvic inflammatory disease, as a result of an untreated sexually transmitted infection, or endometriosis, or scar tissues. Okay, So to explain, we know the sperm and the egg meet in the fallopian tube. So once the tubes are blocked, it means that fertilization cannot happen. And even if ovulation is normal, fertilization cannot. Okay, okay. So the next point is uterine problems. Okay, your uterus may be healthy for should be healthy for an embryo implant. Okay, so issues regarding your uterine. Okay, if you have issues regarding your uterine, such as in the case of leiomyoma, which we commonly call fibroids, it can disturb your uterus and make it difficult for implantation, sorry. And you have polyps, that are small growths that occur in the lining of the uterus, which can cause possible miscarriages. And you have scar tissues, as in the case of Asherman syndrome. And then we have abnormal uterus shape, okay, which can also affect a woman's ability to conceive. The next point is endometriosis. Okay, and endometriosis tends to affect a woman's fertility by causing inflammation, blocking tubes, damaging ovaries, reducing egg quality, and then causing extremely painful periods. Okay, and the next point is age-related fertility decline. What we should know is that a woman is born with all her eggs. So every month one egg matures, and then one follicle matures and releases the egg. Okay, so as you age, your eggs decline, and then even the egg quality also decreases. All right, so as you age, your chances of conceiving also decreases. All right, so that is another point that affects a woman's fertility. Another point is hormonal imbalance. Okay, a disruption in estrogen, progesterone, FSH, or LH may lead to ovulation problems. Okay, and what are some of the things that can cause this? One is chronic stress. Second is thyroid dysfunction. Third, high prolactin. Next, insulin resistance, early menopause, or ovarian failure. Okay, the next point is lifestyle factors. So one is excessive weight or being too underweight. Okay, second is smoking, which tends to damage your eggs. Next is heavy alcohol consumption. We have poor sleep, unhealthy diet, stress, exposure to chemicals, mostly cosmetics, plastics, with BPA. Okay, so that is that for some of the causes of a woman's fertility issues. So let's look at how we can improve a woman's fertility. First point is maintaining a healthy menstrual cycle. Okay. Second, eat a fertility supportive diet, that is foods that are rich in omega-3, folate, iron, vitamin D, antioxidants. So examples of such foods are spinach, avocado, nuts, salmon, berries. Okay, you can look out for other food like that. So the next point is maintaining a healthy weight. Okay, being underweight or overweight, as I said earlier, can complicate your fertility. Okay, so the next point is managing your stress. Okay, stress raises cortisol levels. Okay, and high cortisol levels can disrupt your reproductive hormones. Okay, so the next one is avoid toxins. Next point is diagnose and treat conditions early. PCOS, endometriosis, thyroid issues, and fibroids all respond very well with early treatment. Okay, so if you have an early diagnosis, we can help you with managing your fertility issues. Next point is staying hydrated. Okay, so good hydration improves cervical mucus and uterine lining. Yeah, so let's move on to the next point. When should a woman seek medical help? Sorry. So first point is, if you haven't been able to conceive after 12 months of trying, okay, you should seek medical help. If you are observing irregular or very long cycles, if you're observing painful menstruation, if you have a history of pelvic inflammatory diseases or pelvic infections, if you have recurrent miscarriages, if there's been absence of your period, okay, and then if you have severe acne or unwanted hair growth, that's as in the case of PCOS, you should try and seek medical help. Okay, so this brings us to the end of today's video. If you find it useful, try and share to your friends and subscribe to the channel so that anytime that we post a video on here, you will be notified. Okay, so stay blessed and then see you in the next video. Bye.